the reunion.
When Joe and Eleanor Savarin look back on their last family reunion, they mourn who's missing. Paul, Joe's brother, died before the family get-together, but his spirit was definitely present, as you'll find out in a moment.
I'm sure if he's looking down upon us, he's smiling because he's got that kind of a mind that, hey, I did some good.
The good Paul did was donate his body to the Medical Education and Research Institute, or MARY.
Just a tremendous shock to us, but a pleasant one at that, because it's something that is really worthwhile doing, giving your body up so that doctors can experiment and learn and pass that on. So what a way to go.
Here at MARY, doctors and researchers from around the world use human cadavers to perfect and practice new procedures and develop new medical devices that help ease the pain and suffering of the living and even save lives.
Our point of view, of course, is your soul has gone to rest in heaven, and rather than have your body turn to dust prematurely, your body can continue serving your fellow mankind.
Dr. Kevin Foley founded MARY as a not-for-profit institution funded by several local hospitals and healthcare providers. Hundreds of educational programs take place here each year. It gives doctors, researchers, and medical students hands-on training and practice in a true operating room setting, while dozens of colleagues can watch via a closed-circuit video feed.
Without a place like MARY, especially if this is a surgical type procedure, that physician really can't learn it hands-on in another way. The physician can read about it, the physician can watch it and visit another hospital or OR where it's being done, but can't actually practice until he or she does it on you. MARY is a way to let doctors practice those techniques without placing a living patient at risk.
Hi, this is Brenda. May I help you?
And that's why Brenda Belk's job is so important. As director of the Genesis Anatomical Gift Program, she's responsible for finding enough donors for all of MARY's needs. She also takes care of all the paperwork, transportation, and other details when a donor dies. And that takes a huge burden off the families.
When Paul died, it was one phone call made, and that we did nothing else. Brenda took care of everything, which was a blessing for the family.
Brenda and her staff also lift a financial burden by paying for a memorial service and cremation. Within a year of receiving a body, MARY returns the ashes to the family, or if desired, inters the remains in a mausoleum. Donating your body is as simple as filling out a few forms for yourself or your loved one. And the staff here at MARY is always more than willing to give tours to families to let them see for themselves just how vital the gift of life donation is.
But this is exactly how a patient would be draped.
A tour of MARY like this is just what the Savarins did as part of their family reunion after Paul died. They saw that the bodies are always fully draped and treated with respect and dignity.
And I saw a room with 6 donors, and they were doing a spinal operation, and it was amazing. I was very impressed. Very, very impressed.
So impressed, in fact, that Joseph and Eleanor decided to donate their bodies to MARY.
I will die in peace knowing that my body may do somebody some good.
We couldn't do what we do without our Genesis donors, and we are extremely grateful for them. Their gift really does help not just one, but probably hundreds of living patients. So it really is the ultimate gift.
For Smart Medicine, I'm Rod Starnes.
Joining me now is Chris Cox, Clinical Director of MARY. Chris, thanks so much for joining us.
You're welcome.
Tell us a little bit about the Genesis program and also the benefits of being a donor family.
Many of the benefits are to the family. We don't expect any of the family to pay or incur any cost. We handle all the cost of transportation and cremation after our program, and we donate up to $600 for the family to give to a memorial service or charity of their choice.
Tell us a little bit more about how you use the cadavers.
How we use them is to further surgeon education with the help of orthopedic companies and vascular companies and many other medical companies, to further education before they go into the operating room to operate on live patients.
So if you decided that you wanted to donate your body, tell me how to do that.
You can call us or go to our website. We have a link there where you can look at our donor forms and fill them out, or our representative is more than happy to help you.
With the Genesis program, tell me how your program actually uses the bodies.
Surgeons will come in from all over the world. Typically have them United States, we have Japan, Argentina, and they will come to test and learn new orthopedic devices, vascular devices, and implant them to further education, actually.
Chris, thanks so much for joining us.